Hi everyone, I hope you're all doing well and had a lovely weekend. It's Chloe here from Scratch Magazine. I'm very excited to be with you today because today it is World Diabetes Day and we will be marking the occasion by speaking to Lynn Reedman and Gareth Hicks from Duet Diabetes, who'll be talking to us about how you can support your clients as a nail professional and how you can support them in their treatment and look out for any signs of concern to make sure their safety is priority as always. So we'll be talking to them about how you can do this, but also the course they've set up with Luella Bell, and this course is helping you prepare for your diabetic clients, how from consultation to treatment, and also how to raise any areas of concern with them. So I'm very excited to be learning more about this today. So as always, this will be saved to our Scratch IGTV and our Facebook. So if you need to dip out at any point, you can come back and do that for us. And you can come back and watch it anytime you like. So Gareth and Lynn, if you are there, I'll add you. I'll just see if I can add you now. I should do Lynn, so just inviting Gareth. Hi Lynn.
Hello, hi Chloe.
How are you?
I'm good, thank you. How are you?
I'm good, thank you. I'm just going to invite Gareth to make sure he can join us as well. I'm very excited to get on and talking to you to mark World Diabetes Day.
Absolutely, that's a great idea. Thank you so much for involving us. It was fabulous to be here this morning.
No problem at all. I can't invite Gareth onto the live just yet because he's not joined just yet.
Oh, okay.
So hopefully. Gareth... Oh, what was that? Sorry, Lynn. So I think we'll just have Lynn back in a second. People still watching, I'm sure Lynn will be with us just a second. We're just having some technical issues. Oh, I think Lynn will be back with us any second. I'm just going to invite her again. Hiya.
Sorry, I'm back again.
Hiya. No worries. Gareth still hasn't joined, so should we carry on and wait to join?
Absolutely, I've just messaged him and hopefully, having not done one of these before, he might be just, he's just joined. Here you go.
Oh, perfect. I've just invited you now, Gareth. I've just invited, here we go.
Morning.
Good morning.
Morning, how are you, Gareth?
I'm well. Sorry for being a little bit late. I got delayed.
No worries at all. Thank you so much to you both for joining me today to speak about diabetes on World Diabetes Day, which obviously is a really important day to raise awareness about this condition, and also nail pros can help their diabetic clients. I think it's really important for pros to expand their knowledge and be able to talk about that with their pros. So can you please introduce yourself? What is Duet Diabetes?
Oh, right, yes. So Duet Diabetes. So we provide diabetes and education for the health, social care and the beauty and wellness sectors. That's a more recent one for us, but we soon realised that actually that your industry actually looks at feet quite a lot, and people with diabetes have to take great care with their feet. So we thought you're like an extra pair of sort of ears, eyes, hands for these people living with diabetes, and if you can help them spot and have good daily health care so that they avoid problems in the future, that's why we started to get involved with your industry through Luella Bell. So we're just an education company, training company. So we deliver workshops to health, social care and the beauty industry.
That's brilliant. I think, as you say, like nail pros regularly see their clients' feet on a regular basis. I think what better way than to keep an eye on, because obviously, you know, their clients see their feet every single day, but your nail pro might spot something a bit of concern. So to have knowledge on that is really, really great. So Gareth, what do nail professionals need to be looking out for with diabetes?
Well, first of all, they need to ask the patient if they're a patient suffering with diabetes, but also what we're after is basic foot health. So when they're examining their feet prior to any treatments or services they're offering, looking for simple little cracks, fissures in the skin, breaks in the skin, see what condition the nails are in, etc. We're not after a clinical examination, but you're at an advantage over many clinicians because if you're working in this industry, you're going to be spending a longer time with the patient, so you'll have that greater amount of time with the patient. But yeah, basically giving a once over really, and making sure there's no cracks and fissures in the skin is what we're after to begin with.
Brilliant. And in terms of consultation, you mentioned it briefly in terms of asking if they suffer with diabetes, but is there any other further questions that should be asked in the consultation if they do have diabetes?
There's plenty of questions you can ask, but as a clinician, I tend to go off into medical histories fairly quickly. But you need to ask them if they've had any problems recently. A useful one to ask is when was the last time they had their feet examined? Because what should be happening is, if you look at the guidelines that exist within the UK, they should be seen by either a GP or a podiatrist at least once a year. But thanks to this thing called COVID, I'm sure you heard of it, a lot of people haven't been able to see their clinicians or haven't even seen a GP for 1, 2, even 3 years. So people in this industry, you may be at an advantage here because you've got that amount of time with the patient, plus the fact you're seeing them, and they're comfortable removing socks, shoes, tight stockings, whatever. So yeah, a simple question: do you suffer with diabetes? Another one is, you can ask about if they get any aches and pains in the legs, etc., but keep it nice and simple.
Yeah, we put together, so when we put a course together that's available on the Luella Bell Training Academy, we put together a sort of a nice little summary about the sorts of questions that you could ask your clients, and not just what the questions are, but why you should be asking them, and some of the kind of answers you might get back from them. But I think it's about trying to have that continuity, that some of them might have been advised on certain foot care by their healthcare professional, and they might have forgotten that, or they might have discarded it, or what have you. But then if their sort of beauty therapist or nail pro or what have you is kind of saying similar things and is spotting maybe little things that could be tiny problems now, but could be dealt with so that they don't become big problems, then they're getting that continuity. Because we're not asking them, as Gareth says, we're not asking people to diagnose or to clinically treat or anything. It's just about helping people keep their feet in as good a condition as they can, and if they're not brilliant, then they can seek professional help, healthcare professional help sooner rather than later, really.
I completely agree. I think the nail pro is such a unique position to be able to do this as well, because obviously they talk anyway during their appointment, so to have that sort of level of conversation and say, I'm quite concerned about this, I think is a really good position to be in. So if a nail pro does spot something that maybe they can't really treat, or they're not really sure, they don't feel comfortable treating with, how can they sort of address this? What should they really do if they see any areas of concern?
There's a couple of ways they can go. They can direct the patient back to the GP. That can be a little bit challenging in some parts of the country, we understand that. But you can also refer on to a private practitioner within podiatry. There are services available for the NHS for diabetes within NHS, but they may find there's quite a waiting list there. But if you're going to refer on to a podiatrist within the private sector, we just ask you to make sure they are registered with the Health and Care Professions Council. So it's the letters HCPC after the name, and that means they've gone through a recognised training course and there's a relevant insurance for them as well. But it's either a private practice or a GP. In a few rare cases, it could be that diabetes patient is already under the care of a diabetic foot team, but it'd be extremely rare for them to come and have their feet done if that's what the case is. But yeah, GP or private practitioner is in the first instance.
And finding an HCPC registered private practitioner is quite easy, because if people go online to hcpc-uk.org, or if they go to the Royal College of Podiatry, then there are links there where they can seek out and find an appropriately trained private podiatrist. And I think the other thing, when you asked about what nail technician, nail pro should do, it's also about understanding when they can go ahead and treat somebody that has diabetes, but also instances where they should sort of, when they see the client and think, right, I can't treat these feet because, for example, if they've got a fungal infection. It's understanding what their limitations are, and you don't want to dissuade that client, but it's about going and having that proper treatment, getting that infection cleared up, and then coming back to be pampered or to have that lovely treatment that they would otherwise be providing on that day. So it's just about, you know, sort of appropriately have that conversation with their client.
Definitely. Well, it might be quite a difficult conversation to have, because obviously that might disappoint the client or something like that. But ultimately, I think they'll appreciate the tech putting their safety and health before you know, paying money for an appointment that isn't really safe to carry out. So I think that's.
Yeah, I also think within this sort of the health and beauty industry, you're at an advantage over the clinicians as well, because the patient, are, to me, they're patients, to you, they're clients. It's a 30-year habit I have. But they'll feel a lot more relaxed with yourselves, and they'll spend a lot more time. They know they're not going to get a clinical head bashing, if you like. Whereas if they come in to see people like myself, you have something called the white coat syndrome. So straight away, they're a little bit more anxious. They know they're going to be advised heavily, if you like. They know they may undergo some treatment. Some of it may even be painful. But when they're coming into your environment, they're coming because they want to be there, which is a big difference. But also, your whole attitude is you're there to provide a service which they're going to be comfortable with. So it could be doing their nails, etc. It could be a massage, it could be reflexology, whatever it is, it doesn't make any difference. But they will automatically feel a little bit more comfortable and more relaxed with yourself. So they'll be much more able to take advice from you. So if you do see something you don't like, say, listen, there's nothing, you know, don't worry about it, but why don't you go and have this seen to first? I mean, with fungal nail infection, for example, fungal skin infection, if you get a fungal nail infection, it usually generally means that the patient's had a fungal skin infection for some time. And that's prevalent in around about 30 to 35% of the Western European population. Okay, so it's like athlete's foot, it's a dry, scaly skin, usually itchy. That's fairly easy to treat with over-the-counter medicines. With the fungal nail infection, depending on how bad it is and how advanced it is, that can be relatively easy to treat if we catch it early enough. So they see little coloration changes at the distal tip of the nail, the bit nearest the sort of growing edge, as it were. They can be fairly easily treatable. But when they start getting the whole nail is infected and it starts to get thickened as well, that's when we need the heavy-duty stuff, which is probably visit to the GP or the podiatrist. But you as a profession could spot that a lot sooner, and it makes it a lot easier to treat.
Definitely. And I think, as you say, that change of mindset, you know, the white coat as opposed to somewhere they want to be, can make all the difference. And, you know, someone they're not expecting to hear that from a nail professional either, then they might take more notice. I think it's really good, and especially the course you've launched with Luella Bell. So you've touched on a bit already, but what does the course cover?
Oh, goodness. Well, it covers... It kind of very briefly gives a bit of background to diabetes and why it's important for people to be looking after their feet, and sort of sets out that somebody that has diabetes, you know, that they're at risk of diabetic foot problems developing and progressing quite quickly. That's the thing. That's why it's so important to spot these early signs of any issues, so that they can be dealt with quickly and effectively. Because sadly, that, you know, there's a percentage of individuals will go on to develop a diabetic foot ulcer, which is a break in the skin, a wound, and a percentage of those sadly do have amputations. So, and that can, with somebody with diabetes, that can progress very quickly in a matter of days, or even just within a day. The difference can be massive. So that's why we want them, you know, any issues dealt with at an early stage, really. So we sort of lay the sort of basis there, but also we talk about when we feel it would be kind of safe to treat, but also highlight, like Gareth just spoke about, infections, you know, fungal infections and what have you, and how you can have those conversations to advise and support people to go and get the care that they need. But Gareth you go through all the kind of the background, don't you, as to what a foot ulcer is. We talk about the kind of the nerve damage and circulatory problems that can sometimes happen, and we sort of bring it all together with a demo of a foot examination before carrying out a treatment, really. and just have a conversation about this, don't we? It's quite interactive. So although it's a course that people can purchase, it was a recorded session that we did. So it's a very kind of informal, interactive session, and that gives lots of advice and pointers, as well as sort of downloadable documents, really, to support, you know, your learning and understanding around diabetes and the foot.
Yeah, I should like to just jump in there quickly as well, because if you find something you don't like the look of and you want it checked over, find out who your local podiatrists are. I'll let you into a little secret. I married a podiatrist, and she works locally up in North Wales, but she'll regularly get people from the local nail salon, and sometimes it'll be nothing to worry about. But we'd much rather see somebody and say, no, that's okay, don't worry about it, than miss something. But it's also turned into a two-way street. So my wife will refer people back to them, saying, look, you know, here's some vouchers, or here's something from that. I won't say the name of the establishment, but they refer to my wife, and my wife refers into them. So it's a two-way street.
Yeah, that's a brilliant partnership that podiatrists can have with nail salons, and they can work together on it. And I think the fact it's a pre-recorded session, it means that, you know, techs can take the course in their own time, write notes, do whatever.
Definitely. They can absolutely, one of the things they can download is a copy of all the slides as well, because it's a very visual course, isn't it, Gareth? So there's lots of pictures. So perhaps don't be sitting there having your lunch or your dinner while you're watching it. But it's very, we sort of bring it to life in that respect. So we'll go through that whole process of what you're looking for and what the sorts of questions you might ask your client, but also looking at skin and nails, and the other thing as well that we do touch a little bit as well about footwear and appropriate footwear for people that have diabetes, and also we talk about, you know, sort of particular points to consider when you're carrying out a treatment, and what daily foot care, what good daily foot care looks like for your clients, that you can sort of have that engagement with them and encourage them to daily moisturize their feet, for example. And to be checking their feet every single day, including between their toes. People often forget to kind of delve into those depths and look there, but they should.
Definitely. I think that's all such great advice for nail pros. So how long is the course and how much does it cost? If you were to sit from start to finish, it would be somewhere between sort of 3 hours, about 3.25 hours, I think. It was the final length, but again, obviously you can start and stop because you can define that yourself, and it's £45 via the Llewellyn Bell Training Academy, and like I said, it's not just the watching of the workshop, but there's lots of resources that you can print off, and we signpost you to lots of other organisations and support materials. And at the end of it, once you've completed a short little kind of questionnaire, multi-choice questionnaire, you get a certificate. Oh, I think that'd be brilliant. The certificate is such a proud thing to show in the salon as well, especially for clients with diabetes. They might seek someone who has actually done this course.
Yes, yeah, absolutely. I think the other thing as well that people should still check with their insurers as to what that says and what that covers with regards to treating people with diabetes. But I think if you've demonstrated that you've sort of improved your knowledge and understanding around this, and you've got a good awareness around people living with diabetes, then that's a good start.
Definitely. And so did you say that they head to the Llewellyn Bell Training Academy website to sign up and enroll? Is it quite a simple sign up process?
Yes, it is, absolutely. And if they have any issues, because obviously that's not our sort of website, but the education team at Llewellyn Bell are really supportive and helpful. So if you have any troubles signing up, is just get hold of the education team there, and they will help you through that.
Brilliant. Thank you so much, and thank you so much for speaking to me today for World Diabetes Day.
Oh, thank you. Thanks for the invite, Chloe. Have a good day, everybody. Enjoy your week.
Thank you.
Take care, everyone. Bye bye then.
Bye. Thank you.